Dog Show with me, Claudia. Welcome everybody. Today we're going to talk more about puppies and how to train them. And with me again I have Maggi Burrt from Tailspin Pet Works, amazing dog trainer extraordinaire. Welcome Maggie.
Hi Claudia, thanks for having me.
So one of the things that I want to know, and I bet our viewers at home want to know, is what are the first things they should be training their puppy?
Well, generally, most people will already be doing sits and downs and things, so I don't usually bother with those. I like to teach a positive interrupter for all those times when your puppy is doing things you don't want them to do, like they are at the moment, as well as a hand touch, which is a great way to get your puppy to move someplace or to come to you. Would you like to try the positive interrupter?
Let's try the positive interrupter before the leash is completely cut in half. And we should mention that this adorable little puppy is a surrendered dog and is available for adoption. Where can people go if they're interested in adopting this beautiful 11-week-old puppy?
He's available through justpaws.ca.
Okay, so he's going to come either leash eating or hopefully partially trained, depending on how this goes. So Maggie, tell me what I should do to interrupt the leash shredding behavior.
So any behavior you don't want your puppy to be doing, rather than saying no, which is really not informative at any point, you're going to do a kissy face, is what I call them. Ready?
Okay.
There you go. And
Hello.
yes, and you're going to reward it.
Yes.
So you use the
Good
yes
job.
as a marker to tell the puppy what it is that they did right,
job.
so that they know.
Good job. You can also touch the puppy too, right, Maggie?
You can.
In addition to.
Though, just as a little bit of a guidance, Claudia has Labrador Retrievers who don't mind touches of any kind. This little puppy, I don't know if you noticed, he kind of went when she reached for the top of his head. So I would say probably under the chin is a better idea.
Thank you, Maggie. That's a good tip for me. Okay, so let's do, what would we do next?
Okay, the other thing is a hand touch, which is used, it's a target. You teach your puppy to follow your hand or to come to your hand. So basically all you're going to do, oh, I heard something. What you're going to do is you're going to put your hand next to the puppy's face, like so.
Okay.
And you're going to hold it there and see if he goes to sniff it. As soon as he gets close to your hand and sniffs it, you're going to say yes, and you're going to reward. This is how you begin it.
Okay, so let me give that a try. Yes. Good job. This is a smart little puppy.
He's very, very eager to learn this
People will notice. People think you know, puppies have to be older to learn. Puppies can learn as soon as you bring them home. This one's obviously already offering me a sit and offering me attention by looking at me. So that's very good. So
Food
let's
motivation
see.
helps.
Now he's offering looking at the ground. So let's see.
Get his attention again. There you go.
Yes. There we go. Okay, I put my hand in front, so I guess I get a treat, right?
Yes. So that, yes, that was a little bit, we need him to go to the hand. So you want it to either be to the side where he has to turn towards it, or yes, exactly like that.
That's a
Perfect.
good job. That's a good job.
Lovely.
That's a good job. And when you say yes, if you're slow giving the treat, I think that helps the dog, right?
It does.
Because they know the treat will
Basically,
come.
it works as a bridge. So when you say yes, it tells the puppy, that's the thing, your treat is coming, or your reward is coming if it's a toy or whatever it is.
Excellent. So what can we do now?
Well, what else would you like to work on?
Well, I'd like you to tell us about, like, sometimes people have company and their guests are coming over and they want us to tell the puppy to go and lie down someplace like a mat. And since we happen to have a big mat, I wondered if we could work on some of that.
We could. The mat's a little bit big to be a target for him.
Okay.
But what we can do is talk a little bit about how it works.
Okay.
So, for example, what you would do is you would put a smaller mat, just a little bit smaller or a little bit bigger than the dog, someplace where you can easily work with it. And you're going to start, look, he laid down already. It's magic. It's the magic trainer effect.
That's
there
it.
you go. So you would just take the opportunity to reward that he offered, the behavior. But what we want to do is reward the puppy over and over again for getting on the mat or for laying down on the mat.
Right.
Once the puppy starts to offer it on their own, because they're like, oh, I get it, this is the thing I do that gets me the cookie, then you can call it go to your bed or whatever it is you want to call it. But it is very handy. But for baby puppies like this, he should still be on a leash when people come over.
Absolutely, and he's not too heavy. Oh, I know one. what do you do? Puppies tend to want to jump up on people.
Okay.
Do you have some tips for, because
Yes.
the thing, people that have puppies that are big dogs like Labs or Great Danes or Mastiffs, I would think, and from my own experience, I want to get rid of that behavior before it even begins.
Okay.
So, because it's hard to take the 80-pound dog off your guests.
It is, it very much is. So again, yes, first management, which is a leash. But, oh, you're so smart, puppy.
Yes.
Such a good boy. Yeah, that's too late. It's okay. Basically, what we're going to do, I'm going to put that down, is you have two options. One, you can take the leash, boop, 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 and you can put it under your foot. So they can still, and you say hi to the puppy.
Hi, puppy. Hello, how are you? How are you, puppy? How's it going?
And reach down and see. There you go.
There you go. Oh,
So
good
basically, you're taking away his ability to like throw himself into the air. It's not meant to be holding the puppy down. It's just meant to be using to shorten the leash so the leaping doesn't happen. And if you shorten the leash here, you end up kind of holding the puppy up, which is not what we want.
Yeah, he had some slack in
Good
that
boy.
leash, I
Yeah.
noticed.
You can also do things like if people come over and want to pet him, take a cookie, put it here, and then they can pet. Good job. So you're rewarding him for being in position with his feet on the floor.
Okay. Now, this puppy's very small and is wearing a harness.
Yes.
Do you want to talk a little bit about harness versus collars?
It's a little complicated, but
Okay.
yes.
A lot of this is
Harnesses,
complicated,
everything
everybody.
is complicated, right? It's simple, but it's not. It depends on the dog.
Okay.
It depends on what type of collar you're using. My preference in baby puppies, at the very least, is a harness, so they don't get used to pulling on their collar. Ideally, the goal is to eventually have a dog who is loose leash trained that can walk on any piece of equipment.
Okay, and explain a little bit what you mean by loose leash trained, because I will tell everyone the truth that I might think I know dogs, I might have dogs, but that doesn't mean that I'm not walking down the street like this with my dog pulling me. Which is, once that starts, if you have an 85-pound dog, then it's a snowball effect. Literally, I'm like following a giant snowball running down the street, and that's when danger can happen. So
Okay, so what I want you to do then is, you can't go very far because obviously we have a limited space here. Take a few steps with the puppy. If he goes far ahead of you, you're going to stop, and you're going to wait just a second to see if he stops pulling, and you're going to mark that, and you're going to keep walking and reward him while you're walking. Does that make sense?
I think so, but you'll correct
just
me
say he
if I
pulls
can't
to
do
the
it.
end.
Okay.
You're going to stop for a second because we don't want him to pull us places. And then we wait, and if you get slack on the leash at all, even accidentally, you're going to mark it, and then you're going to start walking again, and you're going to feed him here. So he starts to learn that the pulling doesn't get him places. Walking closer to you or walking without pressure does.
Okay.
Make sense?
Sort of. I'll give it a try.
We'll give it a try.
All right. Let's go. Come on. Let's go. Come on. Let's walk. Let's
Okay.
walk. Let's walk. I walked in front of him.
Look,
again.
he's not going to pull
He's
on
not
you
going to pull. I should get magic out and see real pulling.
Yeah. Good
Good
job.
job.
Reward that.
I'm going to reward that.
So
See, the
if
dog
they do
came
it
back to me and
automatically,
offered to sit.
You're
That's
gonna
very
take
good.
that. Yeah, take that and reward it. It's a little hard because he's very focused on you because you've been giving him cookies.
Yes.
Hence why cookies are so important. Really, what you might want to do is throw a cookie. So he sees you. Make sure he sees you move. Throw the cookie. Don't let him get to it. That'll start him pulling. And then you can see if you can go from there.
Okay. And I should add, before we do that, that you have me training this dog with positive reinforcement like yes or good dog, and also with food. So can you talk about how training has changed from negative reinforcement or aversive training to positive reinforcement, and the positive training that that is used often nowadays?
Well, really, what we've discovered, both with, now he's going to do it, so you can do the exercise while I talk. How's that work?
Okay.
Positive reinforcement, especially with young puppies, reduces the amount of fear. The big issue is what we call classical conditioning. So if you're using something that is painful, aversive, or scary, you're more likely to get a dog who is scared of things. Dogs who are scared of things are harder to train, and they can be aggressive in some cases. So we're trying to reduce that. As much as working with your dog is important, and balance training is not all bad, we do want to focus almost exclusively on positive reinforcement.
Thank you. Well, this has been a tremendously positive experience for me today, and I hope you've enjoyed it too. I've learned a lot, and I think our friend here is already doing a great job. So thank you very much, everybody. Go give your dog a treat, a hug, and a cuddle, and we'll see you next time. Thanks, Maggie.
You're welcome, Claudia.
So I'm here today again with our friend Dr. Alexandra Bedford, a veterinarian practicing in Virginia. Hi, Dr. Bedford. How are you today?
Good. How are you?
Very well. So today we want to talk about a topic of some of the parasites, illnesses, infections that are common in dogs. So let's start with one that I have dogs, Labradors, that have ears that hang down. And so they're prone to ear infections. So let's talk about ear infections.
One of my favorite topics.
Excellent. So tell me, how prevalent are ear infections and how can we prevent and treat them?
Ear infections are one of the most common causes of a veterinarian visit, ear and skin infections. Chronic ear and skin infections are 99.9% of the time caused by allergy. Allergy to either something in the environment or something in the diet, or both. The only definitive way to find out which it is allergy testing. The gold standard for allergy testing is, as in humans, a skin test, which you can go to your veterinary dermatologist and have done. There's a blood test that your general practice veterinarian will probably be able to do as well, and that's pretty good. It will give you generally a list of diets that would be good, which proteins your dog is allergic to. Chicken and beef are the two biggies in dogs. Now, I give ear infections one chance to go away in my clinic. That is, I do a cytology. I find out if it's a yeast or a bacterial infection. You can tell on a slide in the clinic what species, what type of bacteria, whether it's cocci or a rod, but it will not tell you exactly what species it is, and it will not tell you which antibiotic will kill that bacteria. And that's where a culture comes in. In my opinion, a culture is warranted always the second time a dog comes in for an ear infection. And the reason is you have to target your therapy to the bacteria that are in the ear, because of all the medicines that have just been thrown in dogs' ears and in dog skin over the years. We have a prevalence of very resistant and very nasty bacteria, including methicillin-resistant staph, Pseudomonas, Bacillus, all kinds of horrific things I've seen on cultures, some of which only 2 or 3 very powerful antibiotics will kill at this point. So it saves money in the long run because you know what you're treating and you can get it gone the first time. And it also will help humans because we will still have antibiotics for our use if we don't just throw antibiotics randomly at small animals.
Now, I've seen ear infections treated with ear drops and cleaning the ear and maybe some steroids. Are you talking about oral antibiotics for the ear infections or something that's put inside the ear or a combination of those?
Oral antibiotics will not work in dogs. The reason is that dogs tend to have external ear canal infections, unlike humans who most often have middle ear infections. If a dog has a very severe ear infection and the tympanic membrane is perforated and the bacteria have migrated into the middle ear, then an oral antibiotic is warranted. But if it is still in the external ear canal, an oral antibiotic will do nothing. Having said that, it's not unlikely that you're going to have the same bacteria all over the dog, all over his skin, that you do in the ear, because when you think about it, the mucosa and the skin that's in the interior of the ear, the external ear canal, is really just an extension of what's on the exterior of the dog, underneath the hair. If they have a concurrent bad dermatitis, allergic dermatitis, and pyoderma, deep pyoderma, oral antibiotics are warranted. For your average ear infection, an oral antibiotic won't touch it. You have to use a topical. And I prefer to use one that is compounded specifically based on a culture that I've sent out. We put it in, clean the ear out thoroughly, often under sedation so that we can get all the garbage out. Place the medication in there. Wake the dog up. They go off. They frolic for 10 days. They come back in on day 10. We do the same thing all over again. Generally, the second time we don't have to sedate because things are significantly improved. And we do that 3 times. We don't stop until we get a negative culture, especially if we're dealing with something like Pseudomonas that tends to get very resistant very fast.
Now, this is really like from a person who has a breed that's really prone to ear infections.
Yes.
And I have one dog that is incredibly prone, like it's like his whole life, to the point of getting a hematoma. So if you want to explain what happens, because dogs, if it's not treated, they can scratch and then I end up with a dog with a swollen ear. So talk a little bit about that and what you do in that case.
Yeah, you're talking about oral hematomas.
Yes. And oral meaning the ear, not mouth. Yes.
Correct.
Sure.
AURAL. Yes.
Yeah.
ORAL. That is where an oral steroid, ORAL steroid, as well as an oral AURAL steroid comes in handy, because there's definitely a place for steroids in an otitis externa dog. It prevents pain. It prevents itching. It just makes them feel better. It takes down the inflammation in the external ear canal so that the medication that we place gets down deeper into the ear canal is more effective. So I would always put a dog with a very severe inflammatory stenotic external ear canal on a steroid for sure. But before they come to me, often they've been shaking their head for a long time, for a few days. And because they have floppy ears, it's a bit like slapping your hand against your leg. An oral hematoma is really just a massive blood blister. If you think about the ear pinna in a dog as 2 leaves stuck together with a dead space in between and lots of capillaries, the more they flap it around, the capillaries burst, and you just get blood, a huge conglomeration of blood in that external pinna. That has to be fixed surgically. It will resolve on its own, but it will not be an aesthetically pleasing result. So
not with a Staffordshire ear as opposed to a Labrador ear or something like that. Yeah.
A cauliflower ear is what we call it if it heals on its own. Like all bruises, much a lot of things will heal on their own, but they won't always look good when they do.
Now, moving away from the ear into the related topic of allergies. My dog that's prone to ear infection, I had tested and he was allergic to turkey, actually. So Thanksgiving dinner is ruined for him now. But but talk a little bit for a couple more minutes about allergies.
Allergies are more and more prevalent in dogs, especially, sometimes cats, but we see that a lot in dogs. It could be because dogs are outside a lot more than cats, generally, out in the grass, and they're exposed to the trees and all the allergens outside. But there are, like you said, a lot of dogs that have food allergies. For those dogs, I tend to put them on a hydrolyzed diet. It's almost always the proteins that cause the issues in dog allergies. It's rarely the grains, although the dog food companies would like you to think it is, because it's a fabulous marketing tool. But most of the time it's protein. If you think of a protein as a strand of pearls, the hydrolyzed diets have the strands of pearls broken up into the individual pearls so that the dog's immune system will be much less likely to recognize them as being foreign. It won't cause itch. And without the itch, you tend to be able to avoid the infection a lot more easily. There are medications we can use for dogs. Apoquel is one of them. It is a pretty potent immunosuppressive drug. I tend not to use them in dogs over 10. It is a Janus kinase inhibitor, like drugs that are used for rheumatoid arthritis in humans. So, like all of that class of drugs, it does not come without a cost. In older dogs, if there is cancer brewing, it can allow it to take off. It can suppress the white cell count. And if there's any infections brewing, it can allow those to take off as well. So I try and stay away from that unless I have a dog that really needs it, or if it's a dog that has an issue only in one season, like you only need it in June. That dog, I think, would benefit from Apoquel. We can also use Cytopoint, which is an injectable, and it is extremely effective for environmental allergy in dogs. Bathing is a huge one. If you bathe with the correct shampoo, and I prefer a good chlorhexidine shampoo, wash off the allergen. Like if you get poison ivy on your hand, it itches, you wash it off, it tends to feel better, and you get rid of whatever's causing the trouble. A lot of the times you can control allergies with just a diet change to a hydrolyzed diet and bathing frequently during the season when the problems are the most prevalent.
Oh, this has been excellent. Thank you very much, Alex, for coming on the show again, and we'll see you soon. So I'm here with Mara from Mara's Dog Service. Good morning,
Hello.
Mara.
Good morning.
So who do we have here behind us?
Oh, you don't want to have all the names, but these are some of our clients from Mara's Dog Service.
Okay, and tell me about your business. What do you do?
We do a lot of things. We do daycare, we also do boarding, we do a little bit of training, but the main thing we focus on is off-leash group walks.
Oh, that's great. And what community do you serve with your business?
We serve all over Innisfield, like from Big Bay Point until Leafroy.
That's great. And how many dogs do you take out at a time?
It always depends, of course, on the dogs, but between 5 and 8.
Okay, and I see you have a couple of helpers.
Yes, thankfully.
And what do they do? Do they come with you?
So I do the daycares and I do all the office stuff, which gets more and more. And my team, they do the group walks.
That's great. And how long have you been running this business?
Let me calculate. 7 years now.
Oh, that's great. And
Yeah.
what gave you the idea to do it?
So I'm from Germany originally, and I was there a dog trainer.
Okay.
And I just wanted to work with dogs even more.
Wow. And tell me about your dog training methods. What type of training did you learn in Germany, and what do you do here?
So in Germany, everything like bone collars, electroshock collars, they are just illegal.
Yes.
So it was never an option for me, and I'm really thinking the just positive enforcement really works. I work with treats, I work with words, I work with good boy, but that's it.
That's great. And how effective do you find those methods are for training the dogs compared to the more harsh methods?
I think the positive enforcement takes way longer, but therefore the dogs stay that way. If you do an electroshock, they could be good within 5 seconds, and then after a year they just turn around and even get worse.
Or if they don't have that adversive collar on, they might not do it at all.
Exactly.
Fair enough.
And a lot of people say, with the positive, when you don't have treats, the dogs won't do it anymore. Which is just not true, because you're working and you are reducing the treats. And at one point, I say to him, sit, and instead of giving him a treat, I say, yeah, good. And that's it.
Yeah. I think that's true because I compete with my dogs and we can't have any treats.
Yeah.
And so they might get a whole bunch of treats when they're done.
Yeah.
Or when I'm practicing, I might interrupt it in the middle. Like you said,
Yeah.
a variable, what we used to call a variable interval reinforcement is actually the best, right?
Exactly.
Excellent.
Walks, just send me a text, call me, whatever, and one of my team is coming for a free meet and greet.
Oh, that's terrific. And what's your website for people who are interested in reaching you?
It is www.maras-dogservice.com.
Oh, okay.
Hi.
And there's a
Princess.
beautiful black lab. Wow. And you see, you've got a whole bunch of different breeds here. You've got almost everything I can think of, from mixed breeds to, I think I saw a Whippet, I think I saw a Vizsla, and some labs, and poodle mixes, and poodles. Wow.
Yorkshire Terriers. We walk from small and shy to big and goofy. We don't care.
Well, they all seem to get along really well in the group.
Well, most of them are with us since they are puppies. So they are really used to us. They are really used to the other dogs. And this makes me very happy because Loki is normally a very shy dog.
Hi, Loki.
So yeah, it is good for them to learn to interact with other dogs, and it's not about the playing always, it is about the walking together, sniffing at the same spots, responding to the handlers, things like this.
And how long do they come out for every day? How long would a typical walk be? Hello.
So we are saying it is an hour. Mm-hmm. But when you're with these dogs, and the weather is like this, you sometimes don't look at and sometimes I had it before that the owner called me and said, "Is everything okay? You are out already like 3 hours." And I'm like, "Oh yeah."
That's me, the nervous mother. I understand. So,
they are always like, "I love it. I just want to hear if everything is good." And I'm like, "Yeah."
and just the smile on your face and how happy the dogs are, it looks like they really love this.
They do.
That's great. Okay. So Mara, why are you so passionate about dogs? I see you, your eyes light up, your face smiles. What do you love about what you do with dogs? Where's your passion from?
Dogs are always honest, always. You immediately get a feedback from them. You learn every day something new, and some dogs, you really have to work to get their trust. And yeah.
Yeah. And they're the only creature on earth that loves you more than they love themselves. That's what someone used to say to me. Right?
That's right.
Is that right? That's right.